Talking with Dr. Rodrigo Rodriguez with the International BioCare Hospital in Tijuana. Can you talk about the hospital and how it was started and why?
Okay, this is goes back to 1976.
Okay.
First of all, let me tell you, I'm a nuclear physician by formation. So I'm the kind of guy that used to do the scans and look at results, and it's kind of a simple job because you look at a scan and you say this is doing better, this is doing worse, this is about the same, pretty much like X-ray except with the radionuclides. And that was your job. And for that, you would have to go to all the meetings with the doctors and discuss the cases. And then they would say, okay, what this scan tells us. And then we would say, well, this scan looks worse. This person obviously is doing worse with after surgery, after radiation, after chemo, after all this. And when you're in a medical meeting, a high level medical meeting, and you see that type of discussions, there's where you see where the whole thing fails. Because, I mean, short of scratching their heads because they don't really know what to do, they come up with all these ideas of things that you know they're going to fail. So it was kind of frustrating in many ways. So I started working for an alternative medical clinic in Tijuana. I was offered the position, which I accepted temporarily. I said, okay, just to help a friend who had to have a leave for personal reason. So I said, okay, I'll cover for you and I'll be in that hospital. Well, at that time, an office of assessment in Washington wanted to see if Letril worked. I'm talking back 1970s, middle 70s. And the medical director of the clinic told me, why don't you choose the cases that in the scans are doing better? Okay, we have to prove that Letril is doing something. Okay, I went back to the files, looked at cases, not knowing anything, very little about the patient, just they wanted objective signs of improvement. And I took 17 cases, which I thought that unquestionably were doing much better than when they arrived to the clinic. And out of those 17 cases, all of them but one came from the same attending physician. So when I started looking at the cases that were doing good, and I saw that the huge majority came from one physician, it took me a fraction of a second to be in that doctor's office, who was a lady doctor, and say, you know something the rest of them don't know. You're doing something for patients that the rest of them don't know. What is it? And she answered with one word. She said, nutrition. And of course, I was a regular MD with a background in real scientific medicine, like radioisotopes and radiation and photomultiplicators, and I mean the high tech of medicine. So when she said that, I said, oh, come on, Francis, tell me another one. But nevertheless, we became very close friends. We started working together. I started going to see her patients. I started to listen to her explanations and so on. And this developed much more than a friendship in a real medical relationship. We would examine things, go back to records. It is back then, 1978, when I first attended Cancer Control Society, and you saw a lot of things that at the time looked weird. I mean, people talking about vitamin A or C or enemas and fasting and things like that, number one, didn't have any room in what we call modern medicine. But on the other hand, I was born and raised in Mexico City. And Mexico City, back in the 50s, was a very different city than what it is today. It was not that huge metropolis that it's today. And actually, we were raised in the south of the city. We had cows. I mean, my neighbors had cows. It was a total different situation. And both my father and mother and my family were very intuitive about health, as people were in the United States in the first half of the 20th century. People would go on a diet because they had a problem. People would fast. People would use castor oil. People would use enemas. People would use a lot of things. Bed rest was a major tool to treat patients. Okay, all of which was abandoned when we discovered antibiotics and we changed to the medicine that we know today. So I had a mixed feeling of, on one hand, it didn't have any room in my upbringing as a doctor, but on the other hand, it reminded me a lot of things that I saw when I was a child being done, and being done to me. I mean, enemas were not foreign to me. Castor oil was not foreign to me. Cod liver oil, my grandmother would give us, each one of the grandchildren, at least a large spoonful, at least once a week. She would see that we'd take it. And people did a lot of things intuitively to keep their children healthy. So it had a lot of mixed feelings, and I started getting more acquainted with what they were doing, why they were doing it. I met a lot of people. I met Gerson. I met Kerry Reams, people that had all these ideas about acid balance and natural diets and organic and you name it. That, as I tell you, to me at that point was very weird. So we started working with this whole group of ideas, and over the years, what has happened is that the medical literature has endorsed all of these ideas. I have never seen anything that I heard in those days that we had to take back because we were dead wrong. I mean, now we know why cod liver oil works. Now we know why vitamin A. Now we know why selenium. Now we know a lot of things. So we have built a total different understanding of medicine if you want to see it. If you want to sit in your desk and listen to the guy that comes from the laboratory, from the pharmaceutical laboratory, and tells you, doctor, this is the new thing, then you're going to get nowhere. Because I graduated as a doctor in 1968. And throughout all those years, I had people that told me, cancer is over. Now we have cisplatinum. Now we have bleomycin. Now we have this. Now we have the other. Now we have Taxol. You name it. The fact is that cancer today is as bad as it was in 1950. Okay? And I always tell people, if you truly believe that the oncologists know what they're doing, tell an oncologist you have cancer, and he's going to panic. Oncologists that get cancer die of cancer. You just have to open the obituary in any of the medical journals, and you're going to see Dr. So-and-so died of cancer. Dr. So-and-so died of cancer. What does that mean? Doctors don't know how to cure cancer. Neither do I. You see, in the beginning of the 21st century, cancer therapy is still experimental anywhere in the world.